Hello, this is the Pathogen Pair Project, and our project is about syphilis and herpes simplex virus 2, HSV 2, by Haley, Danny, and Samantha. The first pathogen is syphilis. Syphilis is a bacterial infection caused by the bacterium Treponema pallidum. Syphilis has a gram-negative reaction and has a very complex structure. It is said to have a two-layered outer wall, cytoplasm, and fibrils along the Treponemae. Treponemae is a genus of spiral-shaped bacteria. It has a cytoplasmic membrane. The fibrils are similar structures to mesosomes or nucleoids. They are described to have cysts and granular forms. When seen through a microscope, they have a spiral helix shape and a random arrangement. Syphilis spreads to individuals who come in contact with a syphilic sore or other known as a canker. These sores or cankers develop in or on the penis, vagina, anus, rectum, or lips and mouth. The way it spreads is from vaginal, oral, or anal sex. It is even possible that if a woman has syphilis while she is pregnant, she can pass it to her unborn child. Next, I'm going to talk about the signs and symptoms. Most people experience the first symptom within 21 days, but sometimes it can be between 10 to 90 days. These symptoms are experienced in stages and can also be known as the Great Pretender because it has similar symptoms to other diseases. Due to the stages of the disease, individuals can experience symptoms that last weeks, months, or even years. Some may see a presence of sores or cankers on the vagina, penis, anus, lips, or mouth. Some may see a rash on the genitalia and skin and have swollen lymph nodes. In some cases, people with syphilis may experience fatigue, sore throat, weight loss, or headaches. There are multiple stages to syphilis. First is the primary stage. A single canker or multiple cankers is known as the primary stage. These sores are hard, round, and painless and last about 3 to 6 weeks, whether or not the individual gets treatment. They usually occur in places that are hard to notice and may cause an individual to not seek treatment in time and progress to the secondary stage. During the secondary stage, rashes on the skin or mucous membrane lesions, other known as sores in the mouth, vagina, or anus, develop on one or more areas of the body. In addition to the rashes and sores, other symptoms that may occur in the secondary stage are fever, swollen lymph nodes, sore throat, patchy hair loss, headaches, weight loss, muscle aches, and fatigue. These symptoms will go away if the individual gets treatment or not, but without treatment, the disease could progress to the latent or even the tertiary stage of the disease. During the latent stage of the disease is also known as the hidden stage. This is a period during the disease where no signs or symptoms are visible. Without treatment, syphilis will stay in the body even if there are no signs and symptoms. Latent syphilis can last for years. The tertiary stage is rare and only develops when the individual does not seek treatment. It may appear 10 to 30 years after the infection was obtained and could be fatal. Tertiary syphilis can affect multiple organ systems such as the brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. The symptoms vary depending on which organ system is affected. Next is the treatment and prevention. The treatment for primary, secondary, or early latent onset of syphilis is benzalethine penicillin G 2.4 million units, given intramuscularly in one dose in adults. The treatment for latent or latent syphilis is benzalethine penicillin G 7.2 million units total, given in 3 doses per week for 3 weeks at 2.4 million units per dose, administered intramuscularly. The treatment of benzalethine penicillin will prevent syphilis from progressing, but it might not reverse the damage depending on the stage of syphilis. Since many people are allergic to penicillin, alternative options for non-pregnant people include doxycycline and tetracycline. Abstinence is highly recommended until the syphilis sores are healed. Syphilis will start in the primary stage with a canker or multiple cankers. If left untreated, it may progress to the secondary stage where more symptoms are present and rashes may appear. If the individual still does not seek treatment, the disease could develop into the latent stage where there are no signs or symptoms. The last stage of syphilis is the tertiary stage, which could be fatal. This stage affects multiple organ systems. Preventative measures include abstinence from vaginal, anal, or oral sex, or having one sexual partner for an extended period of time. Condoms are also a preventative measure that can reduce the risk of getting syphilis, but people using condoms can still get or transmit the disease. There is no vaccine to prevent syphilis. It is also important to get routine testing. If a woman is pregnant and has syphilis, it could be passed down to the fetus. In some cases, it could result in fetal death, stillbirth, or birth defects. It can be treated with penicillin. The child could develop blindness, teeth defects, deafness, musculoskeletal issues, bone deformities, and Hutchinson's triad. In more recent years, syphilis is very common. Over the last few years, researchers show that in the United States, as of 2022, there are over 203,500 cases of syphilis, and it is still rising. A few years earlier, in 2018, there were 115,000 cases. It was common in 1947, where out of 100 cases, 66.4 were infected with syphilis. The reason why it was so high during this time is because there was nothing to prevent or treat it, as well as it spiked again in the 1990s, but by 1993, it started to drop again. Syphilis is common in other men that have sex with other men in the United States. The reason why it is common in this particular group is because the most type of intercourse with males is anal, where the rectum lacks lubrication, so it is more common to have a rectum tear, where it creates a pathway to the bloodstream, so then leading into getting syphilis if their partner is not wearing a condom. Most outbreaks are in the USA, Canada, Russia, and some areas in Central and Eastern Europe. One major outbreak of syphilis over the years was in Southern California from January through July in 2000. There were 130 cases where men were having sex with other men. 13% were wearing condoms and 18% were taking drugs, making syphilis easier to get. A dosage of penicillin was used as treatment. Some interesting facts about syphilis is it can spread through contact from items like toilet seats. It is unknown where syphilis originally came from. There were two theories of this thought. It was an endemic to America and was brought back to Europe by Columbus in 1492. It was endemic to Central Africa and it reached Europe before the voyage of Columbus. There are some questions that we have to you about syphilis. One is, which parts of the body do symptoms appear as an initial indication of HSV-2 infection? 2, does the virus affect men or women more? And 3, can women get pregnant if they had syphilis in the past? Next, we are going to talk about herpes simplex virus 2, HSV-2. Herpes is a virus that is transmitted orally or sexually, meaning skin-to-skin contact. It is most commonly transmitted through sexual intercourse. The structure of the herpes virus is a 4-layered structure with a double-strand DNA, an icosapentahedral capsule, tegument, and a glycoprotein lipid bilayer envelope. This virus is able to replicate in epithelial cells after 6 days of inoculation. Next, the signs and symptoms of herpes. The most prominent signs of herpes are the blisters, sores, and bumps on the female or male genitalia. These bumps can be red, itchy, and feel like it's burning, and it can also cause pain while ejaculating or urinating. Another main symptom of herpes is the flu-like symptoms that accompany the blisters, typically happening within the first 21 days of infection. These symptoms include fever, chills, headaches, body aches, sweating, restlessness, and more. These symptoms will go away after the first outbreak of herpes. To confirm the diagnosis of herpes, the doctor will order tests like blood work and swabbing the blisters if someone has them. These tests are recommended for anyone having sexual intercourse because this virus can be latent, meaning you might not know if you have it. Thus, precautionary screening is advised. Next is the treatment. There is currently no cure for herpes, and it stays in the body for life once it is obtained. Antiviral drugs like aclovir, valaclovir, and famiclovir can decrease the severity of the recurring outbreaks, but there are no cures. Some topical creams like hydrocortisone can help with the itching and reduce inflammation of the sores. It also helps to use a cold compress on the affected sites. It is important to refrain from touching or scratching these sites if you have any of the blisters. This can spread the virus. If it is left untreated, genital sores can reoccur more often and more severe, along with more pain. Next is prevention. The best and most effective way to prevent contracting herpes virus is to abstain from any type of sex or kissing. Since many sexually active people do not abstain from sex, the next best thing is to wear a condom during intercourse. However, using a condom does not guarantee that you won't get genital herpes. Another preventative method is to be monogamous and only have one sexual partner that you have full communication with. Communication about this virus is key because it can bring awareness to sexual partners and treatment and prevention. Another preventative measure includes taking antiviral medication if your partner has tested positive for herpes. This method could cause you to become resistant to medication if taken over a long period of time, so consulting with a doctor about this method is heavily advised. Next is the epidemiology. There are over 570,000 cases of herpes each year in the United States. Just in 1978 alone, there were 75,000 cases. Then, years later in 1990, there were 150,000 cases. The number of cases drastically increases as the years progress. Sub-Saharan Africa has one of the biggest and highest outbreaks in the world, 37% more cases than other countries. Herpes is more common in women in the United States. It is more easily transmitted to women from men during penetrative sex. Men are more likely to be asymptomatic and not be aware that they have genital herpes. This can easily be passed on to women when men don't know that they are carrying the virus. Next is the case study on herpes. One case study about herpes simplex virus 2 is actually happening right now in sub-Saharan Africa. 3.6 to 21.7 out of 100 women are getting herpes, and 1.5 to 10.5 out of 100 men are contracting herpes. The high unprotected sexual activity in this area is causing an outbreak, and the lack of medical care in this area prevents effective treatment. This community is greatly at risk for women to spread this virus to their children through birth without the treatment of herpes. Some interesting facts about HSV2 is that it has zoonotic origins, where proto-humans in Africa were affected by an ape simplex virus. It is believed that the virus came from Africa by enslaved Americans. However, it is not fully proven. Herpes is carried in saliva, semen, and secretions. 80% of people with genital herpes show minimal or no symptoms, meaning many people do not know they have this unless they are tested for it. Some questions about herpes that we have put in is number 1, which age range is most affected by this disease? Number 2, which country has the greatest number of HSV2 cases per year? And number 3, how does HSV2 affect pregnancies? The next 2 slides are our reference pages. Thank you for listening.